this is the way I'm going to be taking up infections in pregnancy. Okay, so this is the list of my infections in pregnancy. So we'll be discussing with these herpes, varicella, rubella, CMV, hepatitis, HIV, Zika, and coronavirus, which I've not included in this list. But tonight is already going to be pretty exhaustive, so I've not included HIV and corona tonight, but I will be discussing it definitely. Then we'll discuss about the important STDs, which are, to be discussed upon. Protozoal diseases, only them which are important from examination point of view and clinical point of view. Okay, bacterial diseases, which are definitely important and relevant to pregnancy, and the ones which you should know. So let's begin with our class. Let's start with the first one. So rubella. Okay, now rubella, also called as German measles. It's caused by an RNA virus, which it belongs to the Togaviridae family. And this is how the rash in the female, the mother, looks like. Now, so all those diseases you have spoken about in TORCH, that is toxoplasmosis, rubella, herpes, CMV. Why do we call them TORCH infections? Is because of the problem that all of them have a similar attribute of staying in the body dormant for some time and then reactivating, flaring up the moment the immune system of the body decreases down. The most important thing about all these infections alike, which is why they were not regarded as a cause of recurrent pregnancy abortions, was the fact that these infections on the second time are not lethal, neither to the mother nor to the baby. They just come and go. But their reactivation is a cause of concern, and many times also the cause of concern regarding continuation of the pregnancy comes to a hold, because patient and clinician both, they have this doubt of whether this is a first infection or it is happening for the second time, third time as a reactivation. So that clarity is not met with, and which is why these infections, all of them, are very, very important, called as TORCH. So today's class we'll be discussing almost all of them, except of course for toxoplasmosis, which happens to be a protozoal disease, and we'll be discussing it in the next class. So all those infections, especially rubella, in which the mother is not having much symptoms, are all dangerous. You know why? Because patient has suffered at some point in time and nobody noticed it. Since nobody noticed it, the infection was there, it passed on to the baby, and now suddenly you'll get to know that baby is malformed, which is a very big concerning factor, and we have to go back in time to retrospectively diagnose what was the reason of congenital malformations and be very sure whether there was any infection or not in the first trimester, which is why you asked this question of was there any rash with fever in the first trimester. An examiner like me who's very fond of infectious diseases will stop you there and ask you 1,000 questions, and your Viva was actually on maybe preterm labor or prom, but it's gone all towards infections, right? And I'll be justified in asking you that because prom is also either leading to or is a sequel of infection in pregnancy. So your Viva has been totally on infections in pregnancy. Well, you were prepared for prom. That can happen to anybody anytime. So this is a thing, you're getting 1 hour, you should just utilize this 1 hour. So mother's infections usually asymptomatic with low-grade fever and maybe a slight rash, and the rash is very typical like this, okay? And that might go unnoticed. And the patient might be having a little bit of arthralgia or lymphadenopathy, conjunctivitis. But it is the most teratogenic. So that means the maternal effects you just saw, maternal effects are actually nothing. Patient might just have this slight fever and might go unnoticed. But look at the catastrophe it does to the fetus. This is the most dangerous infection, which is why I've taken it first. The most teratogenic agents known, especially when it is contracted in the first trimester, because 80% risk of infection or 80% risk of congenital rubella syndrome. When we will go to varicella zoster virus, you will see that the congenital syndrome, the level is less. The percentage of getting the fetus infected or to that level that it has malformations is less. But in case of rubella, congenital rubella syndrome is seen in 90% patients before 12 weeks of pregnancy. Almost 50% patients between 13 to 14 weeks, and 15 to 25%, 1/4 of the babies will be malformed because of congenital rubella syndrome, because that is the level of incidence of congenital malformations, or if level of effect of rubella on the fetus between before second trimester or before 20 weeks, to be very specific. After 20 weeks it's minimal, but amongst what happens, what does rubella do to the baby? So it causes different kinds of congenital heart lesions like PDA or septal defects or pulmonary artery stenosis, because even this is asked. Congenital malformations like what? Heart disease means what? Congenital heart diseases, patent ductus, pulmonary artery stenosis. CNS defects like what? Microcephaly, mental retardation, intellectual disability. Eye defects, very common, very prominent. Okay, congenital cataract, a very, very important cause of cataract is this syndrome, is rubella. So very important for us to know that this is because of rubella, you have congenital cataract as one of the problems in the eyes. Microphthalmia, cloudy retina. Ear defects, because it has this, it includes cochlear effect, so it goes on to causing sensory neural deafness. Hepatosplenomegaly, jaundice, neonatal purpura, and radiolucent bone disease. This is there definitely, but this is how we usually call it, the congenital rubella syndrome. Specifically with classic triad of PDA, cataracts, and blueberry muffin rash. So it has a rash on the body of the infant, it has this cataract in the infant, and of course it has multiple defects in terms of intellectual growth and heart defects like PDA and pulmonary artery stenosis.